What if I told you that the medication you've been taking every single morning, the one your doctor promised would keep your heart beating and your blood flowing, might actually be slowly, quietly, destroying the lining of your stomach from the inside out? I know what you are thinking. We are told these blood thinners are non-negotiable. They are the frontline defense against strokes, heart attacks, and blood clots. They are the difference between life and death for millions of seniors. And I am not standing here telling you to throw your prescriptions in the trash. But I am telling you that for a staggering number of older adults, the silent cumulative damage happening in the gastrointestinal tract is being overlooked, dismissed as just a little indigestion, or ignored until it turns into a medical emergency. We are going to talk about a specific category of blood thinning and pain management medications that are staples in the medicine cabinets of millions of seniors. We are going to look at why they pose a uniquely dangerous threat to the aging gut, what the warning signs are that you are being taught to ignore, and the evidence-based strategies to protect your stomach without compromising your heart health. This is not a fear-mongering topic. This is an essential safety conversation. If you or someone you love is on blood-thinning medication, you need to hear this. Welcome back to the channel. This is the place where we dig into the real science of aging, longevity, and health, stripped of the hype and the corporate jargon. Today, we are discussing a topic that hits close to home for almost every senior: the delicate balance between protecting your cardiovascular system and protecting your digestive tract. In modern medicine, we often treat organs as silos. Your cardiologist handles your heart, your gastroenterologist handles your gut, and your primary care physician tries to make sure the two don't clash. But your body is not a series of isolated pipes. It is an interconnected system. When you introduce a powerful chemical into your bloodstream to prevent clotting, it doesn't just hang out in your arteries. It circulates through every single inch of you. The drugs we are focusing on today are largely the non-steroidal anti-inflammatory drugs, or NSAIDs, and the classic blood thinners that work by inhibiting specific clotting factors or platelet aggregation. Whether you are on daily aspirin, warfarin, or newer classes of anticoagulants, the mechanism of action often comes with a collateral cost. We need to talk about a phenomenon that is arguably the biggest hidden health risk for seniors: polypharmacy. This is the practice of taking multiple medications simultaneously. For many people over 65, it is not just one blood thinner. It is a blood thinner plus a blood pressure medication plus a statin plus an NSAID for joint pain and perhaps a sleep aid or an anxiety medication. Every single one of these drugs is processed by your liver and kidneys and passes through your digestive tract. When you stack these medications, you are not just adding their effects together, you are multiplying their potential for interaction. Some medications change the pH level of your stomach, making it more acidic or altering the way your gut bacteria survive. Others slow down your gut motility, the speed at which food and medication travel through your system, which keeps the irritating chemicals in contact with your stomach lining for longer periods. When you take a daily aspirin, a common antiplatelet agent, and you pair it with a medication that reduces stomach acid, you are fundamentally changing the environment of your gut. While that acid reducer might prevent a burning feeling, it might also make it harder for your body to absorb essential minerals like magnesium, calcium, and B12. And as we know, low levels of these minerals can lead to muscle cramps, fatigue, and even cognitive fog. It is a complex, delicate puzzle, and far too often seniors are left to solve it alone. There is a common misconception that low-dose aspirin is somehow inert or harmless to the stomach. We have been conditioned to believe that because it's a baby aspirin, it lacks the power to cause real damage. This is a dangerous myth. The stomach doesn't care about the dosage as much as it cares about the habit. Taking a small dose every single day for 10, 15, or 20 years creates a chronic state of irritation. It is the steady daily erosion that does the damage, not just the occasional heavy dose. Furthermore, many seniors are unaware of the hidden NSAIDs in their lives. You might be taking your prescribed blood thinner, but then you grab an over-the-counter pain reliever for a headache or a stiff knee, and you aren't checking the labels. These combinations can accelerate mucosal injury significantly faster than any single drug. You are essentially bypassing the safety checks your physician might have put in place. It's crucial to understand that if you are on an anticoagulant, the barrier between a minor ache and a major gastric event is thinner than you think. You must be hypervigilant about what else is entering your system. Why is this such a big issue for seniors specifically? It comes down to something we call physiological resilience. When you are 25, your stomach lining, the mucosal barrier, is thick, robust, and capable of healing itself at lightning speed. If you take an aspirin or an ibuprofen, your stomach shrugs it off. But as we cross the threshold into our 60s, 70s, and 80s, that mucosal barrier thins. Our ability to regenerate those protective cells slows down. The blood flow to the stomach lining, which is essential for maintenance and repair, naturally decreases. There is also a microscopic change in the way your cells respond to injury. In younger years, your cells have robust checkpoint proteins that identify damage and trigger immediate repair sequences. In an aging body, these signals get quieter. The repair crew arrives later and works slower. So, when you add a medication that is designed to inhibit clotting, which is a necessary function for wound healing, to a system that is already struggling to maintain its own internal security, you are essentially pulling the rug out from under your digestive system's defenses. The primary concern with many of these blood thinners is their effect on prostaglandins. Prostaglandins are lipid compounds that have a massive job description in the body. They regulate inflammation, yes, but they also maintain the integrity of the stomach lining. They stimulate the secretion of protective mucus and bicarbonate, which acts as a buffer against the harsh, acidic environment of your stomach. Many common blood-thinning agents, particularly when used with NSAIDs, suppress prostaglandins. They turn off the faucet of protection. The acid in your stomach, powerful enough to digest steak, now has direct access to the delicate tissue of your intestinal wall. This leads to mucosal injury. It starts small. You might feel a burning sensation after your morning pills. You might feel bloating or discomfort you attribute to something I ate. But over months, this can progress to erosions, tiny pits in the stomach lining. If left unchecked, these can develop into full-blown ulcers. And here is the terrifying part. The blood thinners prevent those ulcers from clotting. In a healthy person, a small erosion might heal. But when on medication designed to prevent clotting, those erosions have a harder time sealing off. They bleed. Often, they bleed slowly, microscopically, without you ever knowing it. The difficulty with silent bleeding is that your body adapts until it cannot anymore. You might ignore subtle energy shifts or feel your digestion is off. It's easy to dismiss these, but when on blood thinners, your threshold for injury is lower. We need to be attuned to these whispers. Your stomach is communicating. It's telling you if it's under duress. Are you feeling bloated? Is coffee harder to tolerate? These aren't just inconveniences, they are data points. Tracking these changes empowers your doctor to make informed decisions. You are being professional about your health management. This is a critical point. Anemia in an older adult should never be dismissed as just part of aging. It is a massive red flag. When your hemoglobin drops, your heart has to work significantly harder to pump enough oxygenated blood to your brain and muscles. This extra strain can exacerbate existing heart conditions, making the very medication you are taking to protect your heart start to work against it. It is a vicious cycle. This, my friends, is why we need to be our own best advocates. We need to stop assuming that every symptom is just the price of admission for getting older. Many seniors are not receiving routine screening for this kind of silent loss. Doctors are often focused on the numbers: your cholesterol, your blood pressure, your clotting time, INR. But they rarely ask, what is the physical state of the tissues this medication is passing through? The clinical reality is that the combination of aspirin and other anticoagulants, even at low doses, dramatically elevates the risk of GI complications. Yet, we often wait until a patient collapses or goes to the ER with severe abdominal pain before we look at the stomach lining. We need to flip this model. We need to be proactive about monitoring the gut while we are managing the heart. It is important to remember that you are an equal partner in your healthcare. When you enter the clinic, you bring a lifetime of experience that a blood test simply cannot capture. If you feel like something is wrong, insist on a deeper investigation. Don't settle for the standard answer that your symptoms are inevitable. Ask for a comprehensive review of your current medication list. Sometimes simply consolidating your prescriptions or spacing them differently can reduce the burden on your GI tract. Be prepared to ask, are there any drug-drug interactions that might be exacerbating my stomach discomfort? Your doctor may not have considered this unless you bring it to their attention. It is your right to understand every single pill you take and why it is necessary. By being informed, you shift the dynamic from passive patient to proactive collaborator in your own health. So, what should you actually be looking for? What are the red flags that your digestive system is waving at you? First, look for changes in your stool. I know, it's not a pleasant topic, but it is one of the most important diagnostic tools you have. Blood from the upper GI tract, the stomach, often looks dark, tarry, or black. If you see this, it is not a wait-and-see situation. That is a sign of digested blood. It requires immediate medical attention. Second, pay attention to the silent symptoms. Fatigue that comes on slowly but doesn't go away with sleep. Unexplained lightheadedness, a pale complexion. If you are on blood thinners, you should be getting regular complete blood counts, CBCs, to monitor your hemoglobin levels. If your iron is dropping, ask the question, why? Do not let the answer be, it's just normal for my age. Anemia is never normal. Third, monitor for chronic indigestion, nausea, or a feeling of fullness that happens even when you haven't eaten much. These are often the precursors to significant mucosal damage. Now, I want to pivot to the part that actually gives us control. What can you do to protect your gut while maintaining your cardiovascular health? I am not suggesting you stop your medication. If you are on an anticoagulant, it is there for a reason, to prevent a catastrophic event like a stroke. If you stop taking it without a doctor's guidance, you are putting yourself at immense risk. The key is risk mitigation. The first step is a conversation with your healthcare provider, and I want you to go in prepared. Ask your doctor specifically about the GI risk profile of your current medication regimen. Ask, is there a gastro-protective agent I should be on? There are drugs like proton pump inhibitors or H2 blockers that are often prescribed to protect the stomach lining in patients who must remain on blood thinners. However, these are not candy. They have their own long-term side effects, including impacts on mineral absorption like magnesium and B12. This is a balancing act. Your doctor needs to weigh the cardiovascular benefit against the gastrointestinal risk. The second step is scrutinizing your over-the-counter habit. Many seniors reach for ibuprofen, naproxen, or aspirin for aches and pains without thinking twice. These are, in many cases, the gasoline on the fire when it comes to stomach health. If you are on an anticoagulant, you must avoid these NSAIDs unless your doctor explicitly says otherwise. They interact in ways that significantly amplify your bleeding risk. For pain management, look for alternatives that don't attack the stomach lining. Acetaminophen is generally much gentler on the gut, though it has its own considerations for liver health. Topical creams, like diclofenac gel, can often provide localized relief for joint pain without the systemic whole-body impact of a pill that has to be processed through your digestive tract. Third, let's talk about your diet. Your diet is your first line of defense for a resilient gut lining. I've mentioned the importance of fiber before, but for someone with an at-risk stomach, the type of fiber matters. You want soothing, anti-inflammatory, soluble fibers. Think cooked vegetables rather than raw, crunchy ones. Think oats, mashed sweet potatoes, and well-cooked legumes. These fibers form a gel-like consistency in the gut, which can actually help protect the mucosal lining. Avoid the gut irritants. I'm talking about high-dose caffeine, alcohol, and spicy foods. When your stomach is already under stress from medication, these things can tip the scale from managed to damaged. Fourth, consider the role of soothing nutrients. Bone broth, for instance, is rich in amino acids like glutamine. Glutamine is the primary fuel source for the cells that line your intestines. It is literally the building block for your gut wall. While it isn't a replacement for medical therapy, keeping your gut lining fueled and strong is a smart longevity strategy. Fifth, manage your stress. I know it sounds like a cliché, but stress is a physiological reality. Chronic stress shifts your body's focus away from digestion. It slows down gut motility and reduces the production of the protective mucus that keeps your stomach safe from its own acid. If you are constantly fight or flight, your gut is the first place that takes the hit. I want to spend a moment on the bigger picture here. Why are we seeing so many seniors suffering from these complications? It is because we have become a pill-first society. We look for a chemical solution to a mechanical or lifestyle-driven problem. If you have chronic pain, the answer shouldn't just be an NSAID. It should be, why do I have chronic pain, and how can I fix the underlying inflammation? If you have cardiovascular risk, the answer shouldn't just be a blood thinner. It should be, how can I improve my endothelial health, my diet, and my blood viscosity naturally, so that I rely less on heavy-duty pharmacological interventions? This is the frontier of longevity. It's not about how many pills you can take to keep your systems running. It's about how many you can safely remove by building a body that is fundamentally healthier. We need to start asking our doctors deeper questions. Are there non-pharmacological ways to achieve the same result? Can we focus on blood flow through exercise, hydration, and anti-inflammatory nutrition? We are not just patients. We are the primary architects of our own aging experience. If you are currently on blood thinners, I want you to take this video as a prompt to be more curious about your health. Do not fear your medication, but do not be complacent about it either. Understand what it does. Understand what it needs. Monitor your body. And most importantly, advocate for yourself in the doctor's office. If you are experiencing symptoms, do not brush them off. Don't tell yourself it's just part of getting older. Being older doesn't mean you have to be in pain, and it certainly doesn't mean you have to accept a silent injury. We are living in an era where we have more information than ever before. We can see the connections between our heart, our gut, and our longevity. We can see that the health of our stomach is a direct reflection of the health of our entire body. If this topic has shed some light on something you've been dealing with, or if you know someone who is taking these medications and has been complaining of stomach issues, please share this with them. The more we talk about these silent risks, the fewer people will end up in the emergency room with a preventable crisis. Hit that like button if you found this information helpful. It helps the algorithm show this video to other seniors who might need this reminder, and subscribe to the channel. We are going to continue exploring the real, actionable science of aging well. I've got more videos coming on how to maintain your physical resilience, how to optimize your nutrition, and how to navigate the modern healthcare system without losing your sense of agency. I want to hear from you in the comments. Are you on these types of medications? Have you had conversations with your doctor about gastro-protection? What strategies have you found that help your digestion? Your experiences are incredibly valuable to this community, and I read every single one of them. Take care of your heart, but remember, the foundation of your health starts in your gut. Keep it strong, keep it protected, and always prioritize your long-term wellness by listening to what your body is trying to tell you daily. I will see you in the next one.